are tight on time today. But I appreciate you making some time. Thank you very much. I'm going to take this off for now.
Oh, my pleasure.
Commissioner, Kelly had told me yesterday, you guys had just asked superintendents and school directors, you issued a new form to them, right, to ask them to start reporting when there's a COVID-related school closure. Can you tell me a little bit about what went into that decision and why you're asking them to do that this year?
Well, we've had so many inquiries as to who's open and who is closed, and it is at an unprecedented level of changing from day to day, and so we thought that it would be important to collect that information so that we would know which schools are open, which are closed. It helps us to target supports where those are most needed, and to be aware of what the COVID situation is in any given community.
When you say there are a lot of inquiries, are those coming from parents?
Actually, no, there are a lot of inquiries from the media and from other department offices across the state who are working together to try to understand the bigger picture of how is COVID impacting our community. And part of public health is the ability of students to be in school and being in person. And when the situation is dire enough to prevent that, that is an indicator of community need.
Gotcha. Is that going to be something that's available to the public? Something somebody can see, like a parent or member of the media or something like that?
I pretty much everything we collect is public information. What that's not its intended purpose, and it is not. It's not necessarily going to be accurate enough for us to. This isn't a batch of information that's going to be watertight and necessarily. We're asking schools to let us know, but it's one way for us to measure and to keep track of who is in the most need and what's happening across the state.
Okay, so it's not a requirement then?
No, it's not. I don't believe it's a requirement.
Okay, got it. Hey, we had a handful of schools, and when I say schools, I should say campuses, already, within 1 or 2 weeks of school starting for each of those respective districts, that have already had to, close down or shift to remote learning and so on and so forth because of doing contact tracing because of COVID-related cases. What's your reaction to that, to see that happening once again this year and so early into the school year?
Well, I think my reaction is the same as the reaction of the superintendents, the school boards, the educators and students and families who are all impacted. Everyone worked as hard as they possibly could to get through last school year. We did an amazing job. It took every bit of resource, energy, and commitment. And we were, frankly, ready to celebrate in June. Nobody could have predicted that we would be starting a school year in the middle of a precipitous surge in the COVID virus across the state. And so to say it's disheartening would be an understatement. It's and yet I have absolute confidence in the capability of our schools to keep students safe, to keep them continuing in their educational progress. And I couldn't be prouder of the schools and all the work they're doing to make sure that COVID is impacting a lot of things in our community. And what we want to do is keep students and schools and learning on a continuum that is forward and positive.
Obviously one of the big, I don't know if concern is the right word, but a point of interest from parents and families, and obviously the teachers and the students as well, and any school staff, is to try to have 5 days of in-person learning if possible. How realistic do you think that is, that will happen in even the majority of school districts this year for even the majority of the academic year?
I think it's possible and highly likely that we're going to see a school year with 5 days a week of in-person learning available for all students. So much effort and energy has gone into preparing schools for this. We believe they have the resources, they have the information, they have the guidance, and they have support from the department and from their communities. And the collective will of everyone to make sure that our kids are having that full academic in-person experience that is so critically necessary for their growth, development, and academic futures.
I do have to ask, is there any new consideration from the DOE about asking for a statewide mask mandate for school buildings particularly?
Well, what we're making sure that schools have the information that they need and the guidance from the US CDC, and that guidance is unequivocal in that they're saying there should be indoor universal masks worn by all people in a school setting right now, particularly during this surge. So I think that's where we stand. And at the end of the day, the implementation and enforcement is at the local level, but there is the universal absolute expectation that schools are implementing universal masking.
So just to clarify, the DOE is not requiring schools to follow the US CDC guidance, but you are expecting them to do so? I want to just make sure I'm clear. Can you just expand on that?
Yes. For all of history, our schools have followed the guidance of the CDC. Schools call the CDC when there's whooping cough or bed bugs or lice. I mean, they reach out and they follow the guidance of our health professionals, because school leaders and school board members typically are not comprised of medical and public health officials. They follow that guidance. It is an expectation because the public health officials know what is safe and healthy for students. And it's one of the primary responsibilities of school boards and superintendents and schools in general to ensure the safety of students and staff throughout the school day. So yes, we would be expecting schools to follow the CDC guidance.
And what happens with schools that don't? There are lots already that have voted on optional mask mandates on their campuses and in their buildings.
Yep. Yeah, we've seen that is the case, and it's very concerning. We know that people are making very hard decisions, and that the wearing of masks indoors has become politicized to, I think, an absurd point right now. I would ask all communities to remember that the most important thing is not politics. It is the well-being of the students. It's the health and safety of the students and staff in those schools. And we're hoping that people will prioritize that, because wearing masks, getting vaccinated as soon as it's possible, and following those other recommended health and safety requirements or recommendations from the US CDC, following those are our best chance to have 5 days a week in-person education for all students. And it's going to take a community effort. Every one of us is responsible for supporting that environment for learning.
But there is no enforcement mechanism for districts that choose not to follow the US CDC guidance?
The Department of Education does not have an enforcement mechanism for that, no.
Okay, there's no other state agency that does, right? Wouldn't be the Maine CDC or anything.
Right. I think at this point, because the US CDC is guidance, it's an awful thing to say, but in some cases, the law of natural consequences is what is enforcing and what is changing the minds of school boards. It's unfortunate that it has to happen in one community. I hope that other communities will recognize that that also could be them, and that they would take action before the law of natural consequences is the enforcer.
Kind of along the same vein, but not necessarily, right on the mask mandate portion. According to the data from the Maine CDC, and I know this data is a little bit tough, right? Because of the way we have our age groups categorized for vaccination. But basically, the closest we can get is ages 12 to 19. 54.9% of those people in Maine have a final dose of the vaccine. But obviously, there's a big chunk of kids who are in a school setting that's not a childcare setting, ages 5 to 11 or so, who can't get the vaccine. How do you protect those kids who can't get the vaccine and in places where masks are not required? Because those kids have ultimately become what appears to be susceptible to the virus and the Delta variant, which obviously you've seen with the stats across the country in all the other districts, right? The states, excuse me. It's affecting kids.
It is affecting kids, and you're right. And we're hoping that schools will use the universal masking, will offer vaccination clinics for those kids who are of age to make use of that. And there are pooled testing programs that are available. In addition, there are several recommended steps that schools can take. They can cohort, especially in those younger grades where kids are not able to get vaccinated, having a stable cohort group, not intermixing kids, to the extent that's feasible, using social physical distancing to the extent that that's feasible without precluding any child from accessing in-person education, hand hygiene, proper ventilation, outdoor activities. All of these are steps that, when layered together, can create protection for all students.
Yeah. I did want to ask you about two of those mechanisms that you just mentioned, right? At the end of, the previous academic year, we've been talking, at least on the Maine CDC briefings with DHHS, about those vaccine clinics at schools. Can you give us an update on where those stand? Are those going to be spread out, across the state by the DOE, or how is that going to work, and what's that going to look like and when?
So my understanding right now, I don't have a list of where they are being held, but I know that all schools have partnered at some point with local healthcare organizations that are working together and they've done this for years with flu clinics in schools, for example. So this isn't a brand new thing. Vaccine clinics are part of what many schools already do. And for those who haven't done it before, they now have partnerships with local healthcare. And even we've had the mobile units able to come out and work with schools.
Okay. The CDC offers that option of, if you're for example, one of the examples they gave was a small business or maybe a church or a group that says if you have more than 10 people and you'd like to have a clinic, you basically raise your hand and ask for one. Have you noticed lots of schools across the state asking for that in particular?
Yes, I know that most schools are planning to host vaccine clinics. I don't have the list right here, but I think most are going to be offering those.
Got it. And I also want to talk about pooled testing. So we kind of talked about this again towards the end of last academic year. I think there's a renewed focus on it now that the summer is here, and obviously the pandemic has surged and shifted. So do you mind? I kind of know the details, but for parents who will end up watching the long form interview that goes on our website, can you explain kind of how pooled testing works and what the potential benefits you see of it, what you see the potential benefits to be? Sorry, that was the sentence.
Yeah, sure. So the way it works is that individuals have their own self-swab situation. Those all go into a common pool, and that is tested at the lab. And if something comes back positive, then there are follow-up individualized tests to find out and isolate the individual who might be positive in that particular pool. And it happens once a week, and it can be done right in the classroom. It's, pretty easy 3 to 5 minute situation. And schools who have done it and piloted it in the last spring and throughout the summer have said that once it's up and running, it goes quite well. The potential benefits are, this has proven in other states and here in Maine to help an organization to isolate, identify, and stop the spread as quickly as possible when there is a positive case in the community. So the classroom community in this particular situation.
And these would be tested within like a single classroom of, 15, 20, 25 kids, right?
That's right. So it'd be one cup of nose swabs per classroom. Those are all tested. If there is any positive result, then they come back and do the individual test to find out who it was that was positive. And then they're able to move quickly rather than, many asymptomatic individuals are spreading COVID in the community, in classrooms and in community-based settings. And so this is one great way to catch that as quickly as possible. And when you're doing it every week, you're likely able to catch that before a cycle of infecting others takes hold.
And I had heard from other teachers and parents who had said that it allows to basically cut down on the quarantine time that a student might have to undergo if they're in a positive result of that first pool, and then it gets narrowed down. Is that accurate?
Yes, that is. Pooled testing and universal mask policies both reduce the number of quarantines and offer flexibilities for students who are identified as close contacts of a positive case.
Do you know how many, is it by campus or is it by district as far as opting into that pooled testing program? And do you have any idea where things stand statewide?
I'm sorry, I don't, but I know I could find out pretty quickly. That's another example of why we're trying to collect a lot of information about who is doing which things, but I don't happen to have that right off the top of my head.
Okay, no, that's fine. But do you know, is it by campus within a district that says we're going to participate, or is it like a district-wide thing that we say all of our schools will participate in pool testing?
I think it's usually by district, but it's a campus program. So if a school is implementing the pooled testing program, that's what would impact the quarantine procedures in that particular school.
Okay, so it is campus by campus at this point.
Yep.
Okay, got it. Round and third and head for home. I appreciate your time. Because I know parents have a lot of questions. I want to make sure I answer them. When we talk about outbreaks at schools, is there sort of a guideline or a standard response that the DOE is asking for of schools to follow if there's 2 or more, cases of COVID that are linked to each other?
Yeah, that's it's frustrating to have to provide the answer that no. Every situation is so unique. The makeup of a classroom, the number of people who are in it, the amount of time that people spent close to one another, the likelihood that it spread beyond a classroom to other settings. There are so many variables that there isn't one response. In many cases now, because of vaccination, because of pool testing, and because of universal mask policies, in many cases, you'll have an outbreak in a school and school continues undisrupted for everybody safely. And in other cases, a positive case could create so many close contacts and potential quarantines and take a lot longer to investigate. And all of those moving parts in the very intricate choreography that is the day of a school student will impact whether there's a partial shutdown, a full whole scale stop with the in-person learning, or if everyone can basically move forward except for those who are very immediately impacted.
Gotcha. Do you know what this may be district by district as well, so if it is, just feel free to cut me off, but what's the policy for a student who has to quarantine? Is that I'm sorry, I should rephrase. I don't mean in terms of the days, right? That's usually it's about 10 days, but obviously that changes based on whether you're participating in pool testing, mask policies, and so on and so forth. But is the general recommendation from the DOE that if you're quarantining, you're not only not going to in-person learning in school, but you're not doing other school activities or non-school activities? Is it truly like a stay-home quarantine, like an isolation?
So in general, yes, the same as anybody in the workplace or other places where folks are identified and asked to quarantine because they were a close contact of a positive case. Quarantine means you'd stay home for 10 days. You wouldn't be out in the stores or doing after school activities or coming to school. And so it is pretty much you're expected to stay at home. There are some flexibilities offered, as mentioned earlier, and I know that these can be pretty confusing for people. We're trying to create a flow chart so that everyone can, understand from home how this plays out. But we know that quarantine, if you are wearing a mask and the sick person was wearing a mask and they were both well-fitted masks and they didn't take them off during the 15 minutes or more, during which time a student would have been within the 6-foot radius of the infected person, then you would be able to quarantine in all other settings, but you could come to school. And that's a big one for families who are suddenly blindsided by a disruption because there's a 10-day out of school quarantine. So students who are in a universal masking school and both the sick person and the other student were wearing masks, they would be able to continue to attend school and only quarantine in the community. And then there's more. If they're participating regularly in pooled testing, they are able to be quarantined only in the community, but can attend school and school activities, school-based activities. So those are the caveats. But in general, a quarantine is a quarantine. You're expected to stay home. And these 2 particular conditions can allow flexibility for those. Oh, and by the way, I forgot to mention, vaccination is the number one. Vaccination, you can be a close contact and you don't have to quarantine. So as soon as that is possible, please get vaccinated.
What has this been like for you, your staff, and then all of the other teachers and staff across the state trying to deal with what you just explained, how many different layers and fingers there are to all of this?
Well, I'll say it has stretched our intellectual and strategic capabilities considerably. I think it has caused us to recognize the importance of communication, recognizing that information is going to change. It's going to change pretty regularly. We're not always going to have the absolute right answer for people. That's a very hard thing for us at the state. That's a very hard thing for school leaders and people who take on those responsibilities, caring for others and making sure that people are safe and that things are functional and going well. It's very challenging to be in the middle of a pandemic that is continuing to rage on and surge here in Maine, and to recognize that we're not in control. We're not in control of that. So what we do is we get really focused on what we can control. We know that there are certain steps that can be taken that can mitigate the impact of that. And that's where we focus our energy and our time relentlessly to make sure that students, I think the thing that keeps our school leaders, they've been shouldering this full impact on the very frontline. School leaders and educators and school staff members have kept kids safe, kept themselves and others safe. Schools have been the safest communities in our entire state throughout all of last year during the first wave of COVID. They've shouldered that responsibility for 18 plus months at this point in time, and it has stretched everybody's capacities. I think it has made us stronger and more forgiving and more proactive. And I think in the long run, I'm just incredibly proud of what we've accomplished thus far and what the schools have done. And I think in the long run, all of us will be stronger in many ways because we have weathered this together.
Commissioner, you've been incredibly generous with your time. Is there anything that I haven't covered with you that you think you'd like to add, or Kelly, obviously take your input as well?
Kelly, did I miss anything?
I don't think so. Chris, I can get you updated pooled testing numbers,
Sweet.
like who's doing what, and I can get that to you.
Oh, you're a beast.
Okay, so
you are the best.
thank you.
Sorry, I said
Keep saying that. That's my boss.
I said you're a beast, and then I realized that's probably not the most formal thing to say in front of the commissioner of the Department of Education.
Remember, I've been working in high schools a lot of my life. I'm used to it. I've been called worse.
I mean beast in the most positive way.
Absolutely, absolutely. Hear that, Commissioner?
I know. I knew it all along. I'm good at hiring.
Yeah, you can say that. Commissioner, thank you for the time. I appreciate it.
Thank you. Take care.
Chris,
Bye,
I'll
Kelly.
shoot that over to you in a little bit. Bye.
You rock. Thank you. Bye.
You bet.